Welcome to Tony Martignetti Nonprofit Radio coverage of the National Conference on Philanthropic Planning. We're in San Antonio, Texas. The conference is hosted by the Partnership for Philanthropic Planning. My guests now are Patricia Roenigk, Director of Individual Gift Planning at Penn State University, and Alex Brovey, Senior Director of Gift Planning at North Shore-LIJ Health System Foundation in Great Neck, New York. And their seminar topic is Big Hat, No Cattle. I love that. Big Hat, No Cattle, How to Effectively Structure a Planned Giving Team. Ladies, welcome.
Thank you.
Thank you.
Pleasure to have you both. You did a survey, or there was a survey done. You can tell us who did it. Alex, let's start with you. About best practices in planned giving staffing. How did that survey work? What were the methodology there?
Sure. So we kept it pretty informal. So we call it survey with a lowercase s.
Did the two of you do the survey, or it was done by PPP, or who?
No, we did the survey. We surveyed PIGNI, which is the New York group, the New York Council of Philanthropic Planning Symposium. We asked people a couple of questions in a summer survey, and then we followed up with some of our vendors who assist us and some select people around the country that we thought had some pretty good programs. And we didn't necessarily identify who these people were. We picked them because they're people we had worked with who we knew had good programs.
Okay. And how many survey participants were there? How many institutions?
I would say that there were about 60 to 70 institutions represented.
Yeah, okay. And this your conference seminar is also based, Pat, on your combined experiences.
Yes.
Okay. Why don't you give us a little background in your own gift planning experience, since that relates to the topic?
Well, I came from the for-profit world. I was an attorney with the firm that represented the Penn State University. So I had about 15 years of experience working with the development office on the for-profit side. Then went to work for Penn State as the director of, then it was planned giving,
All right.
soon to evolve into gift planning. And have worked through that, worked with my colleagues in the Big Ten, et cetera.
And so how many years on the nonprofit side in gift planning and planned giving?
The combined about 30 years.
Okay, 30 years experience. And Alex, why don't you tell us about your planned giving, gift planning, individual plan, however, whatever moniker it falls under, because it all relates to your expertise in the conference topic.
Sure. I have about 18 years of experience, and I sort of followed in Pat's shoes. Pat was actually my boss when I was at Penn State for 5 years.
Oh.
And I was fortunate to have her, and now we're still together, and we get to present, which is a lot of fun. And then I moved to New York and worked for Pace University, which is a private educational institution. Then I spent a stint at Stony Brook Foundation, working for a public institution. And now I'm at a large health system in the New York metropolitan area.
All right. Pat, are you still evaluating Alex's performance?
Every day.
Yes, okay, very good. Knows her place. No, obviously peers. Okay, so Pat, let's talk about some of the lessons that come from the survey and, as I said, from your own experiences in staffing. What expertise do we need to look for in staffing? Now, keep in mind the audience for our show is small and mid-sized nonprofits. So that could be anything from a small shelter where maybe there isn't a devoted planned giving team, up to maybe a good-sized college that in the big scheme of nonprofits is still a mid-sized nonprofit, but would certainly fall within our listenership, and they could very well have a planned giving person or team. Mm-hmm. What type of expertise are we looking for?
Well, one of the things as we first started to talk about the topic, is we discovered when you work for something as large as Penn State University, you're working not for one giant institution with a lot of gift planning experience. We have campuses where there might be 900 students, and where you go for 2 years and then matriculate to University Park. And so our experiences, we have a hospital system as well, graduate schools, et cetera. So there are such diverse enterprises that we bring to that all those common experiences. Mm-hmm. For each of these, we looked at some of that commonality, what it is what you needed to have an effective team. And I remember coming to a conference 3-4 years ago where the presenter was talking about metrics. What do we have to expect from our staff? And I was sort of dissatisfied when I left because there wasn't a score sheet that you would just use in every situation. So that's part of what Alex and I kind of focused on, is that really is true. You can't create one scorecard. You've got to look to the institution you're serving.
Okay. And what areas of expertise are appropriate, let's say, for something that might be just a two-person plan giving operation?
Well, that's the case where you've got to make that small shop feel very large. You've got to develop expertise. You've got to be able to rely on the vendors, some of the people that we work with, whether it's the software company, the PG Calcs or Crescendos, whoever's helping you with your software, because when you have a question behind the scenes, they've got experts there that you can ask the questions. The people that do your newsletter, people that administer your plan gifts, whether it's the various banks you work with, because in the small shops, they don't necessarily have one provider.
Yeah.
So it's going to those people and asking them the questions. And then creating advisory boards. People in the communities really want to help. I mean, you may find a lot of expertise within the people that you normally serve.
Okay, Alex, you want to say more about advisory boards and expertise that you might be able to find in the community?
Sure. Regardless of the size of your organization, it's helpful to have a couple of people who you can turn to if you have a question. You can certainly turn to your colleagues at PPP or your local council, but you might want to turn to someone who's familiar with some aspects of your program. So I'm in basically a one-person shop, but at a very large organization. So I turn to some of the people that Pat spoke about. Our estate planning committee at my place happens to be comprised of a little bit over 53 members at this point in time. So those are people that I could send an email to, ask a question of. They come from various walks of life. They're attorneys, accountants, financial advisors, some people that work in the insurance field. And if I have a question, I feel like I can turn to them for their expertise.
Now, a committee of 52 or 53 probably doesn't meet, or if it does, it meets once a year over cocktails or something. Why don't you explain to listeners how the committee works? We understand you're fielding ad hoc questions to them, but more generally, how does that committee work for you?
Sure. So a plan giving advisory committee or an estate planning committee varies depending on the size institution. I've been at 4 places. The institutions, at one of them, I didn't even have one. So I had to create relationships with people that support your organization. So it might be someone who brings in a large bequest, or an attorney who calls you once or twice because they have a donor who wants to give something to you. Those are the relationships you start to formulate, and that's how you start to create them. At my organization, we meet 5 or 6 times a year. We have about 20 people come to every meeting.
Oh, so the committee actually does meet. Oh,
we
okay. So I misunderstood.
We actually do. And a lot of the places will set aside meetings. The question is whether it's worth your time, your limited time if you're in a 1 or 2 person office, to do this. But these are people you can turn to when you have a question. But when we do convene meetings, we actually talk about something related to plan giving or gift planning. So we'll talk about the new tax act, or we'll talk about in New York, we have the new law that extends benefits of marriage to unmarried people or to gay people. So we can get together and talk about that topic and how it affects our plan giving program, for example.
Okay. And a little more about the expertise that might be on the committee. You mentioned attorneys. Can you go a little broader? What expertise might we be looking for a committee?
Sure. So attorneys would probably have a background in trusts and estates, estate planning, estate administration, but they might also have a background in family planning and business succession planning, and even real estate, because the types of gifts you could get in might be a gift of a house, a gift of a closely held business asset, a gift from a couple that perhaps they were together when they set up a trust and now they're not together, and how do you handle that? So these are the types of expertise that these people can provide. Accountants are a wonderful source of information because they're the ones that your donors and prospects see every single year, whereas they might only see an attorney once every couple of years. They're visiting with their accountants every year for different reasons.
Okay, Pat, is there anything that you want to add that's different maybe at Penn State in the way you work with an advisory committee? Anything you want to add?
Our committee's actually kind of small. And they do meet twice a year.
Okay, so that's interesting. So Penn State's a bigger institution than North Shore, than the LIJ, but has a smaller committee.
I think the reason is that it's the difference between being community-based and nationally based. We have a number of experts, and we draw on people that would represent a lot of the charities in this room. I mean, part of their expertise isn't necessarily just in working with the donors. Some became part of the committee because they were working with a large donor that we were working with, but most had some previous connection to Penn State. I mean, whether they're a graduate or just one of the many fans.
Okay. And does your committee meet from time to time, the way
Yes,
Alex
twice.
was describing? Yeah, twice. Okay.
Twice a year. And we bring in speakers to talk to them about things that are happening at Penn State. I mean, right now in the Northeast, everything's Marcellus Shale. It started at Penn State.
Marcellus Shale is the fracturing for oil drilling. Is that
Yes,
right? Oil
yes.
For gas? Is it?
Natural gas.
For natural gas.
Yeah, and
Right.
some of our professors actually developed the technology. The people that are being impacted by it are work with our outreach office in the local communities. The extension agents are their first contact when a farmer is being asked to lease his property. So it's a terrific. Since we were sort of on the ground, we're providing that service out to people, and now we're looking at those people who are suddenly going to make have a lot of wealth, and leaving some of it back in the community. So we're doing outreach back to the community foundations and Penn State itself.
Are you using volunteers, Pat, in another way besides from the volunteers on the advisory committee? Are you using volunteers? Is that part of staffing planned giving?
Well, not just planned giving. We have volunteers. We're in the middle of a capital campaign, so we have volunteers at every college. Every unit has a campaign committee, and our volunteers on the planned giving committee and our staff in gift planning are meeting with those volunteer committees and explaining the planned giving concepts. When I get back, we've got a new donor advised fund, so I've got to make a presentation to one of the campaign committees in one of the colleges to let them know what that is and see it as another gift planning opportunity for their donors.
Okay, and to what level are you training the volunteers in these other committees in terms of their exposure to planned giving? How trained up do they need to be?
It's letting them see the possibilities. In fact, Alex and I did a presentation a few years ago about cues and clues, and it's letting them see that the best answer is sometime we have someone here who can help you. And so the volunteers understand that they are gathering information, helping us to recognize possibilities, and then understanding that we offer a lot. I mean, talking to them about a donor advised fund is really telling them that this is just one more thing. They relate it to all the other donor advised funds that are out there, but it's possible to do it through the university.
Yeah, okay. Alex, anything you want to add about working with other volunteers aside from the advisory committee you and I talked about?
Sure. I would just say that for those who work in hospitals or health systems, you have your obvious volunteers at each hospital, the kids that start when they're candy stripers all the way up through the older people who are retired and find this very rewarding to do. And we're actually having an event for them next week for our volunteers at one of our hospitals, and they are champions for our cause. They're our ambassadors. They're out there on the floor with our patients and the people who come to visit, and they represent that particular hospital to the community, and that's very important when you're a community-based hospital.
And in terms of training, Alex, Pat was just explaining how the training goes with volunteers. Do you find a difference between training volunteers and training gift officers, non-planned giving gift officers in planned giving? Do they get trained to the same degree, or gift officers a little more? How does that?
Yeah, I spend some time every couple of months training the major gift officers and learning things in turn from them. So the major gift officers, Pat mentioned the presentation we did a couple years ago here called Cues and Clues. It's knowing what to look for or listening to something that a prospect or a donor says and then being able to respond in an appropriate way. So I do hold trainings. I have taken advantage of PG Calc's webinars. I will purchase them and then show them to my staff. I feel that's a very good training. And when something comes up, I send tips of the month. Not every month necessarily, but I do send tips of the month saying this is something to keep in mind at this time of year. So at year end, it might be gifts of stock. It might be taking advantage of the IRA law, allowing money to come out of an IRA for a certain age group. And I give them the parameters in the email and always my contact information. We're a relatively small staff. We're at about 50 in our foundation. So it's pretty easy for me to walk up to almost any of them and say, do you need my help? Or for them to come to me.
Okay. And Pat, anything you'd like to add about training gift officers that's maybe different than training volunteers around planned giving?
Well, we've done a lot of training at the university in a little more thorough and letting them understand how the gifts work. And it apparently is working, because one of the things I always do when I come here is meet people who used to be at Penn State who were in very different roles. One woman worked for us in research. She's now working in planned giving in another institution closer to her hometown. So a lot of our alums from not necessarily Penn State alums, but development alums are here in plan giving work. So I think it's working.
Okay, you're sort of evangelizing. You didn't intend to, but you're evangelizing for planned giving. All right, I like to be a planned giving evangelist, without the religious overtones. No, it doesn't have to be religious related. No, I mean I consider myself a planned giving evangelist.
Feels good.
Yeah. Okay, Pat, let's stay with you, and let's move to performance evaluation. I think that was a part of your seminar topic also. What's the advice that comes from your combined experiences, and then also the survey around evaluating outcomes?
Well, the more people we talk to about the, I always call it our report card.
Okay.
And it's but people are using scorecards, they're using metrics, they come up with all these ideas, but they're unique to the institution if they're going to work. We have lots of institutions, or lots of times where we're asked, how many visits do you require? What's the nature of those visits, what percentage? And it really has to be institutionalized. It has to be what makes sense for them. So we sort of encourage people to start backwards into that. And what's the expectation? How much money do you want to raise? Where do your alumni or where do your constituents live? So that you're able to get something that makes sense. If you set a standard that's not going to be reached, it's not going to be rewarding for the people that are out there. So one scorecard doesn't fit all was pretty much the conclusion.
Yeah. How about the issue of who gets credit for bringing a prospect in, whether it's the major gift officer who might bring someone to the plan giving office, but then if the plan giving officer completes the gift, crediting that, this is internally in terms of performance evaluation for the employees. How do you advise around that?
Well, the question was, do you reward or do you require collaboration? And sometimes when you require, we set a standard that said every person, every fundraiser at the university had to work on 3 planned gifts. And this was something that the major gift officers and the planned giving officers worked out. And we work as liaisons to different colleges.
Did that include other gift officers too? Annual fund gift officers?
Not
also,
everybody
but
the annual fund, just the major gift officers in each unit.
Okay.
And with each of the units I work with, I identified for each of them, here's 3 that you can
of your prospects. We've identified 3 of your prospects
that we can close a planned gift on, so that you're absolutely guaranteed success.
All right.
Tried to vary them with my colleagues so that they were going to get not just 3 bequest expectancies, but that they would have the opportunity to work on gift annuities, and then they started bringing them to us. Here's other people I see the possibility in. So it was required, then became rewarding.
Yeah, no, that's a great kickstart. Yeah. Alex, you're doing a lot of nodding. What in terms of the crediting for prospect relationships and closing gifts, what are your thoughts?
Well, at a smaller place, I have one-on-one contact with all of the major gift officers. And since I'm the only person who does gift planning...
And let me just ask, you said 50 in your shop, but how many are there? How many major gift officers are there?
About a dozen.
Okay.
So when the issue of a planned gift is raised, or when they get notice of a bequest expectancy, or when someone passes away, that information always comes through me. We don't have any set requirement that anyone work on a particular planned gift, but everyone, just like Pat said, everyone is encouraged. And so I will try to train them so that they know when to look for it. And I have a couple of those frontline fundraisers who I've been working with more and more, and we use them as an example to the rest of the staff of how this works. There's one frontline fundraiser at one of our hospitals that's a couple of minutes away from where most of us are located in the central location of the foundation. He sent a letter out to some of his patients, and the ones who were extremely grateful responded and were interested in doing charitable gift annuities. And I think I closed half of the gift annuities that particular year a couple of years ago with this one major gift fundraiser. So this is the type of working and giving an example and doing this over time and setting a standard that hopefully at some point will become practice, like Pat's, where you encourage everyone to have a couple of planned gifts that they're working on every year just to get comfortable. At some point, it should become matter of course and doesn't really need to be stated that you'll be working on it, because the best gift for anyone might very well involve a planned gift. And once someone's trained and understands that, that's what it'll evolve into, especially during a campaign.
I think these are great lessons in collaboration, generally. Ladies, we have to leave it there. My guests have been Patricia, Pat Roenigk, Director of Individual Gift Planning at Penn State University, and Alex Brovey, Senior Director of Gift Planning at North Shore-LIJ Health System Foundation. Their conference topic, Big Hat, No Cattle, how to effectively structure a planned giving team. Pat, Alex, thank you very much.
Thanks, Tony.
It's a pleasure to have you. This is Tony Martignetti, Nonprofit Radio, coverage of the National Conference on Philanthropic Planning, hosted by the Partnership for Philanthropic Planning, coming to you from San Antonio, Texas.